Thank you, Caoirleach, and thank you to the Minister and the HSE for coming before the committee today. Both of the opening statements from the Minister and the HSE representatives make reference to the Progressing Disability Services. The programme intended to reform services and supports for children with disabilities through the creation of the Children's Disability Network teams. In particular, Mr. Regan's statement claimed that the programme provides fair access to services based on needs, ensuring that clinical teams work with families and with education staff to support children and young people. But I have to conclude from situations from multiple parents that have explained to me, like the accounts from them, people who've come before the committee, that Progressing Disability Services is currently a failure, simple as. In September, there were 41 children waiting for initial contact with the West Cork CDNT. 11 of these children have been waiting less than 4 months. 30 children have been waiting between 4 and 8 months. Just to give one example, from the very many constituents who have contacted me about this, one child with ASD has received 1 hour of occupational therapy and 1.5 hours of speech and language therapy in the 15 months since their assessment of needs. And I suppose some families can afford to pay for this privately, but it really shouldn't come down to who can afford it and who can't when we're talking about early intervention. The committee has discussed a case in Cork where young people won't be able to access spaces in special classes in secondary school because the CDNT won't be able to make the recommendations in time. And I know that, obviously you can't discuss in particular cases, individual cases, but I'm citing these as evidence of the failure of the Progressing Disability Services to date. I don't expect you to comment on the individual cases. The teams are obviously not sufficiently staffed. Promises of staffing next year are not good enough for the children that need interventions yesterday or 15 months ago, not to mind over the coming months. So staffing next year isn't going to address that. I have a long list of constituents with major issues with the shortcoming of the CDNTs, and I'm sure all public representatives do. And I'll be contacting them later on today with your response. So I'm wondering what if any, assurances can you give them that these issues are going to be addressed? And previously, the HSE offered that the committee could visit a community disability network team, but it was one of their choosing. And I have been trying for months now to meet with the West Cork CDNTs, and I'm just wondering for the Minister if you could help me arrange that. Thank you.
Thank you, Deputy. Mr. Regan.
Thanks, Deputy, for your question, and I'll invite Professor McLaughlin to comment as well. I think the nature of the reform and change that we're doing in children's disability services is very significant and is one of the most significant reform programmes. The reorganising of the children's network teams, which will be completed this year, is a major shift in trying to reconstruct how services are delivered so that they are fair and equitable. That has to be accompanied by expanding the size of those teams and the staffing on them. Significant additional posts were allocated for this year, which are being put in place, and there will be additional increases next year. But it's also about introducing new ways for those teams to work, like the standard operating procedure that we've introduced, so that people can have their needs assessed as expeditiously as possible, and that we can get into the space of intervention, aligning it with the assessments that need to happen. This is one of our most significant priority areas. Colleagues both at CHO, CDNT and nationally are working in alignment with each other in order to effect the changes that are needed. And it's in order to make sure that the kinds of issues that you're identifying, that we have a system in place that those kinds of issues become redundant, and we have a service model that is easily accessible, isn't reliant on families having to use resources in order to access private services, and that we have an equitable system. I don't know if maybe Professor McLaughlin might want to comment further on it.
Yeah, thank you, and thank you for the question, Deputy Cairns. I think we all share the frustration that you've expressed and of your constituents, and that's really one of the reasons that we have been motivated to develop a completely different approach to providing services for children with disability. As you know, previously, the basis in which people access services was often to do with the area they lived in, or what school they attended, or indeed how rich they were, or the nature of their disability. So the design of the CDNTs is supposed to create a situation where there's equal opportunity of access. And I would suggest that the PDS approach is working. So, for instance, if you consider the preliminary team analysis, which has been incorporated as part of the assessment of need procedure, 86% of children who are assessed through that process have an intervention immediately recommended. Just to give you an idea, that prior to the introduction of that standard operating procedure, sometimes people were waiting for 4 or 5 years for an assessment, and then there was a subsequent waiting list for the intervention. So we would certainly acknowledge fully that the teams are not yet fully resourced. The Minister has been very successful in terms of getting funding to support the resourcing of those teams. There is also a pipeline issue, so we need more therapists across a whole range of different specialties. So unfortunately, it's not a matter of us being able to immediately resource all teams fully. We need to identify the pipeline of producing and educating people, not just within, if you like, the traditional approaches that have been taken, but the CDNTs are very much focused around the ethos of the CRPD, which emphasises interdisciplinary working, moving away from a sort of deficit medical model and so on. And that also requires a change in work practices amongst the different clinicians. So, I mean, we would share your frustration, but we are committed to the idea that this is the right way forward. It's certainly compliant with the CRPD, and I would submit that it's already showing very encouraging results.
Can I just quickly respond to that, Chair, if that's okay? Because I can't say that I can see those results on the ground yet, and that's not the experience of families. And you say the design is for equal access and that it's working, but it's not. That's not the experience of families. Like I said, there's a family who had a diagnosis for their child 15 months ago and had overall 2.5 hours of essential therapy. And you reference, the previous 5-year wait, that's an incredibly low bar. And, the case that I'm talking about is pre-assessment of needs. And then you're talking about therapists, more recruitment next year. So I think, the reality there is that nothing is going to change in the next year. People are going to continue to wait and have to pay privately. So it's not equal. It's only people who can afford to pay for it who are getting the services. And are we maybe at a point where we need to, at the very least, be honest with families about the wait that they're looking at, rather than just them being fobbed off by the CDNTs and not hearing back from them, and all of the energy and effort that goes into trying to get these services when they are just quite literally not available? Is it high time that we at least acknowledge that and maybe look at supports in the meantime whilst we're building up staff teams, perhaps subsidised for the private sector, because that's the only option that people have at the moment. And then for some people it's not an option because they simply cannot afford it.
Minister, do you want to come in? I know you indicated you want to come in this, but so does
I'll let that conversation finish because
okay.
I want to answer Deputy Curran, or in relation to something Deputy Curran has asked.
Okay.
Thank you, Deputy Kearns. And in relation to the Children's Disability Network teams, this is a huge government change programme. There will be 91 teams absolutely in operation at the end of this year. Some are already in operation, and this has been ongoing in the Midwest, for example, CHO3, for a number of years. So the teams will be there. I suppose we're not, the last, and this is not an excuse, but certainly the pandemic has affected, there's no doubt about that. But I chaired a meeting yesterday, and I must say that the information we were seeing was very, very encouraging, as my colleague Professor Malcolm Loughlin has just alluded to. The whole premises of PDS, or progressing disabilities, is around the child and family first, and very much away from the medical model. When the teams are operational, there will be local implementation groups. Families are very much part of that, so it's important that they have a voice and their voice can be heard. And if there are issues, we need to address those issues. Again, just to acknowledge the Minister and the Government's commitment to this programme. The resources have made a huge difference and will make a huge difference, and we're very, very aware that children is the formative years, and it's so, so important, and working closely with our colleagues also in education. And the good news is that those 91 Children's Disability Network teams are coterminous with the primary care teams, and that's really important because, again, in relation to therapists and so forth, my colleague Professor McLaughlin alluded to the fact, yes, we do need to train more therapists. We do need to retain them. And again, the commitment from government and the additional funding will certainly help there. There's a lot of change, and we are seeing good progress. And yes, we need to be very much in partnership with families, because we very much recognise that the family knows their child better than anyone, and that we work in partnership with them. And yes, you're right, we need to have that honest conversation, and I think that we will see more of that as we go on. And certainly there's great commitment, there's great passion, and there's an energy around that whole progressing disabilities. And I think that next year you will see a very different picture as those teams bed down, and we are seeing huge progress at the moment. So certainly, while we can't comment on individual cases, certainly I'm sure my colleague Bernard O'Regan will be taking that up with the particular CHO and the head of service there. Thank you.